They look identical. Same clear liquid, same little vial, but mixing these two up can be the difference between a safe injection and a serious medical emergency. This is bacteriostatic water versus sterile water, and here's what actually separates them. Let's start with what they share. Both are sterile, meaning they've been purified and processed to remove living microorganisms. Both are non-pyrogenic, so they won't trigger a fever response. And critically, neither one should ever be injected on its own. Both are designed to dilute or dissolve medications, not to be a treatment by themselves. Here's the whole story in one ingredient. Bacteriostatic water is simply sterile water with one addition: 0.9% benzyl alcohol, a preservative. That's where the name comes from. Bacteriostatic means it holds bacteria static. It stops them from multiplying by disrupting their cell membranes. Note, it doesn't necessarily kill bacteria outright. It keeps their growth in check. Sterile water, by contrast, is pure. Just purified, sterilized water with no preservatives and no additives at all. This preservative unlocks the biggest practical difference: how long you can use the vial. Because bacteriostatic water resists contamination, it's designed for multi-dose vials. You can withdraw from the same vial multiple times, typically for up to 28 days after the first puncture, when stored and handled properly with clean technique. Sterile water has no such protection. Once opened, there's nothing stopping bacteria from growing, so it's meant for single, immediate use, then discarded. Reusing it, or sharing it between patients, invites contamination. They also have different official roles. Bacteriostatic water is labeled specifically for injections: intravenous, intramuscular, and subcutaneous, where a medication needs to be dissolved and used over several days. Sterile water is more versatile in one key way. It's labeled for both injection and irrigation. Think wound care, flushing, and surgical uses. And when a medication's label says, "Use preservative-free water only," sterile water is the required choice. Now, the most critical safety point in this entire video: that same benzyl alcohol preservative that makes bacteriostatic water so convenient makes it dangerous for one group: newborns. Bacteriostatic water is contraindicated in neonates, infants under about 28 days old, and especially premature babies. Their livers can't yet fully metabolize benzyl alcohol. It can build up and cause a potentially fatal condition called gasping syndrome, with symptoms like metabolic acidosis, breathing difficulty, and organ failure. This isn't theoretical. It was identified after infant deaths in neonatal units in the early 1980s, which led the FDA to warn against benzyl alcohol in newborns. For any newborn, or when a drug label demands it, preservative-free sterile water is used instead. If someone has a benzyl alcohol allergy, bacteriostatic water is off the table. Sterile water is the safe alternative. And remember, never inject either water by itself. Plain water isn't balanced with your blood, so injecting it undiluted can rupture red blood cells. These waters are carriers for medication, not the medication. So, same look, very different jobs. Bacteriostatic water, preserved, reusable, for repeated injections in older children and adults. Sterile water, pure, single-use, more versatile, and the safe choice for newborns and preservative-free needs. Knowing the difference protects patients. Always read the label, follow your pharmacist or prescriber's instructions, and when in doubt, ask before you draw.